This video is going to look at massage for treating wing scapula. The scapula or shoulder blade is the largest bone of the shoulder and it's got 17 different muscles attached to it. These muscles both stabilise the arm and allow the arm to move. The muscles work together so well, but when something goes wrong it can lead to the scapula winging, sticking out, so that the shoulder blade sticks out on the back rather than laying flat against the back of the chest wall. If it's mild, it might not even be noticed. More severe cases can be painful and you get a loss of function, so loss of movement and control over the shoulder too. Why does it happen? It can be an imbalance in the muscles, injury to the muscles or to the nerves that supply the muscles. It can also be symptomatic of muscle wasting, for example in people with muscular dystrophy. Poor posture can contribute. Overuse of specific muscles can be to blame, for example with weightlifters. It can lead to an inability to lift, pull or push heavy objects or to perform daily activities such as brushing your teeth, combing your hair, carrying things around. Treatment really depends on the underlying cause. The most common cause is weakness in the serratus anterior muscles and damage to the long thoracic nerve, which supplies the serratus anterior muscle. There's more detail about the location of these in the textbook, so do cross-reference to that. Some cases may need surgery, but a lot will respond really well to strengthening exercises and to massage. Secondly, if the underlying cause is overall muscle degeneration with a condition such as muscular dystrophy, then there'll be a weakness in all of the scapular stabilizers. In this instance, it's important to treat both sides of the arm, shoulders and back and not just one side. The muscles are likely to be tighter and smaller due to the muscle degeneration. Another cause of wing scapula is dislocation of the acromyoclavicular joint, it's really hard to say, or a fracture of the outer third of the clavicle. That usually happens after a specific trauma or injury. In this case, it's important to liaise with the client's medical practitioner because there might also be severe ligament damage and you don't want to make that worse. If it's been a repeated dislocation of the shoulder, for example with a rugby player, then the wing scapula is secondary to the shoulder dislocation and strengthening exercises under the supervision of a physiotherapist would normally be the treatment of choice. So let's look at contraindications. Number 1, if there's been a recent trauma to the area which has resulted in the wing scapula, it's got to be checked medically. Number 2, if the area is swollen or inflamed, wait until that's fully settled before you treat. Number 3, if there's significant muscle degeneration around the shoulder due to a long-term condition, take extra care not to slip onto the bones when you're massaging. Number 4, if there's a history of shoulder dislocation in this client, work alongside their physiotherapist. Massage can assist in the recovery of a wing scapula, but it needs to be carried out in conjunction with the strengthening work, and your client's physio or doctor will be able to provide those exercises unless that is within your training and your scope of remit. So we're firmly into the grounds of working as part of a package here, working as a team. We're focusing this work on the most common cause, weakness in the serratus anterior muscles. The aim of the massage is to relax the musculature of the shoulder joint to allow the scapula return to a normal position. As the muscles are able to relax, the scapula will just retract against the back and normal function can return. As with massage to the elbow or shoulder, it's important to release the tension for where it might be held. In this case, it's the detailed work on the hands that we looked at in the hand and arm video. So we're never going to go straight into the shoulder without doing that work first. I'll show you this with the work with our client, but I'll talk it through first. Remember, if the serratus anterior is tight, then working on it might be very tender for your client, so make sure you work within their tolerance. It can be so oversensitive that to begin with, even the gentlest of touch will feel painful, so we have to build our depth gradually as we work. We're working with the client on their side, with the arm on the affected side raised above the head. Support that with a pillow if necessary. In women, you'll only be able to access the muscle as it emerges from underneath the breast tissue. Be careful with your draping to keep the client covered. With male clients, you'll be able to work a little further in. If you use the nipple as the guidance, you're starting to work about 2 to 3 centimetres outside of the nipple. To begin with, we work gently to warm this area up, starting from the ribs, working backwards towards the scapula. Once away from the breast, you can do the fascia release work in any direction. Once you've done this, with your thumb and using massage oil, working quick movements against the run of the muscle, so cross-frictional work. In this case, up and down the body as the muscle is sitting front to back. Small and fairly gently movements with your thumb, moving just 2 to 3 centimetres each time. This might be tender, but it shouldn't be excruciating for your client. Work from the bottom to top, starting at the 9th rib. Remember that the front of the body, the 8th, 9th and 10th rib pairs don't connect directly to the sternum, but they're connected to each other by cartilage that attaches to the costal cartilage of the 7th rib pair. So we start further back in the ribs on those ribs so that we're following the muscle. Work slowly and methodically up, rib by rib. Stop short of the armpit so you're not working on glands. Once you've warmed the area up for at least 3 or 4 minutes, you can begin very specific treatment. Be careful to differentiate between muscle and rib and slowly pull back towards the scapula. You're looking to loosen up any tension held in this area. Work slowly. I make a lot of use of static pressure here, just a static hold, mixing up, sliding along the muscle and holding it to allow it to release. So we've already mentioned some of the work for the winged scapula in the cross references. We're now looking at this work here. We're going to work across the front. You can see I've got my client on his side with his arm raised above his head so that I can really access this area here. It's a form of fascia release. I'm just avoiding the armpit. And you're working from just outside the nipple really to the midline of the back. Because it's a fascia release move, I'm not going hugely deep, but you can see this is an area where the skin is actually quite tight, so you will need to press a little bit more than you normally would if you were working on the back. So you can do cross-frictional work. I'm doing it here without oil, but if the skin is dry, then you can do it with oil. And I can do that deeper release. So what you're aiming to do is to free up any tension that's held in this side part of the body. You then need to follow up with the intercostal work, just cross-reference to asthma for that rather than me showing you it again here. But you can see that it's a press and release. I'll just show a little bit, but I won't go into as much detail as we did for the asthma one. And then you can come back. This is almost, although it looks like a fascia release move, it's also, because it's quite a difficult muscle to get at, you're doing that cross-frictional work, but because I can't do it with my thumbs here, I'm just doing it with my fingers instead. Just be careful as you get up to here that you don't slip into armpit. Because of the client's position, it would be quite easy to do that. So the aim here is that you want to release any tightness here to allow the scapula to return back into its place at the back.
If you found this video useful and want to see more like this, make sure you subscribe below and don't forget to hit the notification bell.